So yes, this is me, Dr. Emily, and I'm excited to talk to you guys today about how to study for the next gen NCLEX. And in order to do that, to understand that, you need to look at the purpose of the NCLEX. What are they even trying to figure out by administering the NCLEX? Then we're going to look at what the top 5 Nclex topics are, and we're going to spend most of our time today doing some live question practice because, again, practicing answering questions is the best way to convince yourself that you do know what you're doing after all, Michelle. So first, what is on the NCLEX? And there is actually an official NCLEX test plan. You can go to the NCSBN website and review this. They have detailed statements about each of these client need areas. So for example, something about using hand hygiene for infection control, checking 2 patient identifiers for safety. So the NCLEX actually tells us what's on the test, and based on a practice analysis survey where practicing nurses submit and answer a survey saying, here's the things that I do every day and here's how important they are, they're going to give you more questions that test those things that are really important that you're doing really frequently. So this is meant to be representative of real nursing practice. What are the things that are keeping our patients safe is about 13%. That's helping manage or direct the care at that unit or system level. That's your prioritization, delegation, assignment, keeping everything running. Health promotion and maintenance, so assessing whether children are meeting developmental milestones, making sure that women are gaining enough weight during pregnancy, vaccine prevention, things like that. Psychosocial integrity, so your therapeutic communication. Basic care and comfort, that's your skin care, mobility. Pharm, everyone's favorite. Reduction of risk potential, so preventing complications of surgeries or procedures like Foley catheter insertion. And then physiological adaptation, which is kind of the bread and butter of how to assess and manage diseases as a nurse. But that seems like a lot, but actually these 5 topics make up over 70% of the exam. So 24% of your exam comes from clinical judgment. This is new for the next gen NCLEX, where they test your ability to think like a nurse, and they do this using the case studies. Management of care, pharm, physiological adaptation, and safety and infection control follow. But you can see that the big one, far and away, is clinical judgment. And that is why it is so important to have a lot of practice with really high quality case studies that are actually representative of the real test. So we'll move on to talk about the clinical judgment measurement model. And this is the 6-step process that the NCLEX uses to outline how a nurse thinks. And yes, this is going to parallel your 6 questions on a next-gen case study. And so you're going to get 6 questions in a row, and each question is going to correspond to one of these steps. And these terms might not be familiar to you guys, but this pretty closely correlates with the nursing process, which you should be familiar with. So I'd also like to ask you guys, how many of you learned this in school or in some way, maybe in class? You went through these 6 steps for a certain disease process, or is this just brand new to you guys? So have you seen this before or not? But we're going to talk through each of these steps one at a time. So again, the next gen is going to put these into their case studies. They're going to have 1 question per step, but just for the sake of going through all 6 steps today without making you guys read through a full case study, we have chosen some of our most popular standalone questions from our bank that best represent each of these 6 steps in clinical judgment. Because at the end of the day, the NCLEX is really all testing our clinical judgment in clinical scenarios.